So looking at the possible etiologies or causes of acute coronary syndrome, we've been talking about acute coronary syndrome for a while now. So let's look at the possible things that could actually cause this condition. All right. So etiology or causes of acute coronary syndrome. So I've got to establish that acute coronary syndrome is basically a disease condition affecting what? The coronary artery. Is mostly due to a deposition of fat at the walls of the what coronary artery. Okay, so looking at the etiology now, we say that atherosclerosis is the primary disease which is responsible for what acute coronary syndrome. So looking at this now, this is atherosclerosis, which is what deposition of fat at the walls of a blood vessel, right? So about 90% of cases of myocardial infarction are okay, they will result into acute thrombus that can obstruct what and atherosclerotic or coronary artery. They are simply tell you that it will basically okay if there's a deposition of fat, it will do like this till what it can lead to what blockage. It will narrow the pathway or it will lead to total blockage and all of that. Okay. So looking at this now, we said that what this plaque can actually rupture and erosion and the thrombus formation is what associated with what local coronary artery spasm. Okay, so that's basically what unstable angina. So this is a dynamic process whereby the degree of obstruction will either increase, leading toward complete vessel obstruction. Because as it is blocking like this, it can increase to a level that what there will be complete blockage in this vessel. All right. So it could lead to complete vessel occlusion or regress due to what effect of platelet disaggregation or endogenous fibrinolysis. Because it simply means that if there's formation of this what atherosclerosis, that's the position of fat, two things are involved. Either it will lead to total blockage or it will resolve. Do you understand? That's what it means. Okay, so that's just it for the etiology. There's no other cause. Yes, there could be, but the primary cause is what atherosclerosis. It could be due to blood clots, but the blood started clotting because there was atherosclerosis. You get? So I think that's it for the etiology or causes of acute coronary syndrome.